Hello and welcome to this Uni Taster On Demand event today, where we're going to be exploring university courses in nursing. I am absolutely delighted to be joined by Paul Bates from the University of Lincoln. Paul is a senior lecturer, but also an advanced nurse practitioner, and is really well placed to talk about the nursing subject area. Paul's got loads of hands-on experience, loads of academic experience as well, and we'll cover why you might be interested in studying the course, what to expect on it, application tips and careers. And just to remind you, the subject we're looking at today is nursing. And with that, I'll pass to Paul Bates from the University of Lincoln.
Hi, my name is Paul Bates. I'm a senior lecturer here at the University of Lincoln and an advanced nurse practitioner. I've been nursing now for about 20 years and I still practice nursing as an advanced nurse practitioner in a local GP surgery, a couple of shifts a month, and I also lecture across our suite of health and social care courses here at Lincoln. I first want to start by just explaining how I got into nursing. Back in the late 90s, I was in my mid-20s and I was a waiter for Pizza Hut. And I'd always had a bit of an interest in biology, but I had a proper light bulb, life-changing moment when I went to visit a friend's father in intensive care. And there was a male nurse looking after her father then, and I just looked at this nurse and thought, my God, you're amazing, and I can do that. He was obviously quite intelligent and was doing lots of technical caring work with all the machines that were involved in looking after this gentleman in intensive care. But he was also really caring, and he was caring to the patient he was looking after and the family as well that were visiting regularly and obviously very concerned. And it really opened my eyes to what nursing is. Now, this is the sort of picture that you probably picture as nursing. And I think a lot of the public view nursing as this sort of old-fashioned nursing, maybe thinking back into the 50s and even the 60s, of nursing as the knowledgeable doer and being there to hold the hands of the patient and do whatever the doctor tells you to do. Now, to some extent, it is part of the nurse's job. You know, there's nothing better than being there and listening to somebody when they've got troubles, or giving them a cup of tea when they're thirsty or worried about something, holding their hand in the darkest times. And it really is probably the most rewarding part of nursing. But it's not just nursing. And this is what made me realise when I went to visit this gentleman in intensive care. Nursing is so much more now. You've got to have a bit of biology to be able to understand the physical care you will do. Not absolutely essential, though, to get onto nursing. I always say, if you want to apply for nursing, if you're caring and got a willingness to learn, then you will go for. And biology can be taught, but the empathy and the caring nature has to come from within you. So your course will involve some biology. It will involve some anatomy, some physiology, and some pathophysiology of what goes wrong in the body. There's also an element of psychology as well, because you're caring for people, and you're caring for people at a really vulnerable time when they're very worried or they're in pain. And you need to be able to manage the patient and their family as well. And you will hear the term biopsychosocial nursing going on all the time. So you're looking after the biological, the psychological, and thinking sociologically of how these illnesses are affecting the family. And when I say illnesses, I really mean illnesses as opposed to disease. So disease will look at the more biological side of it. But as a nurse, you're looking at the much bigger picture. You're looking at the illness, and so how that disease is affecting somebody and how that is affecting the family, and the family psychology and the sociology of how they get on with their life. And you will be looking at all of that, and you will have a massive influence on these patients' lives and their family lives as well. The course you were doing is going to be science-based as well. And when I say science, I'm talking about evidence-based practice. The care we deliver is not just picked up on the street. It's evidence-based. So you will be trained to read from journal articles and textbook and looking at peer-reviewed sources. So you don't just take one person's view for it. You look deeper into it. You see what one person's saying and what another person's saying. And you will be pushed to look at journal articles that have been produced and put out in the public. To produce a journal article, it needs to be peer-reviewed. And for that, it will be passed around into lots of different people in that field to make sure that it's robust and it's what is being said is scientifically, factually based. This is what higher education is all about. It's not just taking one person's view for it, but it's looking at what everybody's saying and why they're saying. So instead of just looking at one study, you will look at many studies on a subject, and you will look really closely into those studies to see whether it's been double-blind study, whether it's been done on 10,000 people or 20 people. And we will train you to look deep into that evidence base so you produce the best care possible. Most courses, probably all nursing courses, won't teach you to be a specialist in any particular area. They are designed to make you a professional, safe practitioner. So once you qualify, you then choose what specialism you want to go in. And when you are dealing with people's lives and you are advocating a better standard of life and a better quality of life, you need to be professional. The public, the British public, expect nurses to be kind, caring and professional. And we get overseen by the Nursing and Midwifery Council, who will ensure that and make sure that all nurses maintain those standards. So we will teach you and train you to be an upstanding professional to carry this career forward. The nursing courses will also help to teach you diplomacy and management skills. You'll be managing not only people's lives and their wider scope family, but you'll also be managing a ward environment, or wherever you're working, you'll be managing staff and people at the same time. It's not an easy task, and that's the beauty of nursing. And I think it's one of those things that people don't necessarily understand, and certainly I didn't. And that's why this eye-opening light bulb moment when I first met a nurse on intensive care really shone through. As a nurse, you're not just there to do the hands-on work. Yes, that's part of it, and it's a very rewarding part of it, but you're also there to manage staff and manage a department and manage people's lives. And we will make you do that by training you to be professional and give you the understanding, biology, psychology and sociological knowledge to deliver that evidence-based care. Some other interesting topics that you may want to know about. So there's several different fields of nursing. There is child nursing to teach you to look after children, mental health nursing, adult nursing, and some universities offer learning disability nursing. Now, over the last few years, those fields, the nursing fields as we call them, have started to blur a little bit. So quite often those fields will be taught very closely together, and you will maybe branch off a few times over the 3 years to just specialise a little bit. Now, I particularly teach clinical skills and emergency and urgent care nursing. So what I say to all my students, no matter what field they come from, is that you need to know a bit about every single field, because this is what the public expect. Therefore, this is what the Nursing and Midwifery Council design the nursing courses around, or the universities design their courses and then go to the Nursing and Midwifery Council to get them approved. Now, if you walk past and you a member of public and you see somebody having a heart attack, if you're a child nurse, you can't just say, well, I can't do anything about that. This patient is over 20, and then walk on by. The public will expect you as a nurse, no matter which field you, to be able to at least look after somebody who's having a heart attack until the emergency services come along. If a patient turns to you and feels, I'm feeling really low at the minute and I'm thinking of self-harming myself, you can't just turn around and say, well, I'm an adult nurse, I'm not mental health trained, and walk on by. So we now teach these different fields alongside each other to make you a well-rounded nurse with some sort of knowledge in all areas. All nursing programs will involve 2,300 practice hours and 2,300 theory hours. This is stipulation by the Nursing and Midwifery Council. So you do half over the 3 years, you'll do half your learning in class, learning nursing theory, and half in practice. Your practice placements will vary. As I say, most courses don't teach you to be a specialist in any area. So you might do a little bit of community nursing, you might do some emergency nursing, you might do a general ward, you'll do some clinics, and you'll be passed around your local area to get as much knowledge and as much information as you can. And each of those different placements you will carry for the rest of your career. I still remember, and I still use in practice today, the 6 weeks that I spent on the renal dialysis unit, or the 6 weeks I spent on an ophthalmic ward. And all these different placements, you'll go around picking up what's good and what could be done maybe slightly better to make you a well-rounded nurse come your qualification. Assessments for all universities nowadays will be assessed on many different levels. You will have some written assignments, you will have some OSCEs, which are objective structured clinical examinations, more practical assessments. You may have poster presentations, you may have virtual presentations where you'll be assessed. Universities try and assess you on many different levels because we know that we all just don't learn the same. Applying for courses, you would apply through the normal UCAS routes, and depending on the course that you apply for, however many, there'll be various different UCAS points which are needed. You will also need your GCSE or equivalent in maths and English. If I can give you a few tips on applying, I would say try and get some experience working with people. Nice if you can get something like working in a nursing home or working in your local hospital or something like that, but just generally working with people, because that's what you're going to be doing for the rest of your career. So if you can get that, try and do some reading generally around nursing. I often recommend the British Journal of Nursing is a very good periodical journal to read. The more you read, the more you will understand the academic type writing you'll be expected to do at university. The British Journal of Nursing is also quite interesting because it'll give you general tips and case scenarios on all the different fields of nursing, and it will also keep you updated on general nursing and things that are in the news at the minute. I would just recommend read and read and read some more. It doesn't matter what you're reading, because when you're coming to do a degree, you will be reading for a degree and you will have to write certainly a good proportion of academic essays. So the more you read, the better. And be critical of what you read. Don't just take one person's view for it. Think about why they're saying this and what is their evidence behind what they're saying for it. Nursing is the best career I've ever done. Never looked back since the day I saw that gentleman in intensive care. It's not long after qualifying. From about 2 or 3 years after qualifying as a nurse, your career will really start to take off if you want it to. I tend to think after a few years, you get a bit of a 4-point prong in your way you're moving forward. 2 or 3 years, you might be pushing towards junior sister or junior charge nurse if you're male. And here you can start going towards the management route. So if that's the type of thing, managing people and managing staff, you can push your career that way. You can also go into research if that's the way you want to go. And if you're interested in this evidence-based practice and looking at how you can improve departments and nursing, that's the research route. You can also go down education. So you can start doing clinical education, if you like, and teaching the staff that are there in the departments or on the wards or out in the community. And you can also go into independent practice, which is the first way I went before I went into education. So as an advanced nurse practitioner, I've done extra courses in diagnosis, prescribing, clinical history taking. So at the minute, I work alongside GP colleagues in GP surgery, seeing, treating, diagnosing. And there are many different routes into nurse practitioning. There's many in the hospitals, surgical nurse practitioners, paediatric nurse practitioners, emergency nurse practitioners. Nursing in particular in the last couple of years for newly registered nurses, many what we would call advanced roles are now incorporated into newly qualified nurses. So things like listening to chests and differentiating breathing sounds, taking bloods, inserting cannulas, reading and interpreting ECGs are now taught as standard on undergraduate nursing programs. So again, going back to that old-fashioned nurse's view is just not the case anymore. What would traditionally be advanced roles are now incorporated into the newly qualified ones. But it doesn't take you long, if you want it, to progress your career as fast as possible and specialise. And even then, even if you decide not to specialise, the world is your oyster with this career. You can pick and choose where you want to work in the world. You've got a career for life, a pretty well-paid career as well. And you can go working in Canada and then think, oh, I'm a bit bored of working in Canada. I'm going to go back home to the UK. And then I'm going to work as an emergency department. And then after 4 or 5 years, you think, I'm a bit bored of that now. I think I want to see people more on a longer term basis. So I'm going to go and work in the community and have my own caseload working around there. And then you think, oh, I'm really actually like this palliative care bit, doing the caring side there. So you can go and work in palliative care. I tell you what, you are never bored with this career. There's that many different options open to you. You have a job for life anywhere in the world, and you will never be bored because there is so much to learn and so much to do. I want to make just one last little point is it is a tough job. It can be quite demanding. Some of the hours can be unsociable, involving night shifts and longer days. And some patients and some aspects of the job can be a little bit challenging. So you do have to have some element of resilience. However, pretty much all courses have resilience built into them. So you will have a personal tutor wherever you go to university. So my personal tutor group, there's about 20 student nurses in, and this sounds really cheesy, but what I say to them is, look, I'm like your big brother. If you've got any worries, just come to me. Just give me a call any time of day on Teams and I will answer it. And I'm there for you and I'm there to support you. Your universities should offer clinical supervision as well. This is where you get together in a little small group and you can talk about what is good about placement and practice and what is bad or what could be changed, how could you be supported, and you learn as a group and debrief as a group. Universities will also offer support centres for general student inquiries. There'll normally be a well-being service. You'll have local healthcare services. Some universities have a GP surgery attached to them. Occupational health will also make sure you're healthy, both physically and mentally, while on placement. And most universities, well, all universities have a student union and a multi-faith centre as well to help support you. I can't stress enough how great this career is. And I can't stress enough how great a career it is, whether you're male or female. Bit of an old-fashioned view now that nursing is female-oriented. Still 1 in 10 nurses are male, but we are really starting to push to try and get the word out that, look, it's not a predominantly female job. It's so much more than what the public perception is. Science, man management, biological, psychological, sociological. You will have a lot of responsibility and you will have a lot of influence over patients' lives, not just the patients, but their families too. It's just the best job in the world, without a doubt. It can be tough at times, but I tell you what, it just takes one person to turn to you and say, I was in pain, and you've cured that. I was really worried about this, but you've sat and listened to me and reassured me. Thank you. And I tell you what, you can cope with anything after that. It just makes your day, week, month to help somebody, and for them to just turn around and say thank you and know that you've made a difference. Come and join me in the best career in the world. Thank you.